Alrighty. Okay. Hello, everyone, and welcome to the third webinar that we've run for this series. My name's Abby Hunt, and today's guest is Luella Frost. Welcome, Luella.
Thanks, Abby. Thanks so much.
So today we're going to be having a bit of a chat about leadership effectiveness, in particular around delegation in the health sector. And Luella is a professional coach, executive coach, and has a lot of experience working in the health sector. So I thought I'd throw it over to you for a few minutes in terms of, a little bit of an introduction about yourself and your experience within the health sector and why you're quite passionate about this topic.
Oh, thanks, Abby. Yeah, I am passionate about it. As I think it's an area where new leaders in particular in the health sector can be curious around how can they sharpen up delegation skills. My own experience with developing delegation skills certainly came about from transitioning from being a clinician into a leader of clinicians, if you like, a leader manager. So now responsible for managing a clinical service as well as line managing clinicians and other staff, working as a team to deliver a quality service to people in the community with health needs. And I think my journey was potentially similar to some others in that I'd been a clinician for a period of time, really enjoyed that, and had good relationships with my clients and getting some great outcomes, and was invited to move into a supervisory type role where I had line management responsibilities. And really for me, I'll completely admit my focus was definitely on managing the service. I knew I was surrounded by great clinicians and I was very keen to deliver the very best service we could for our clients, and really didn't spend a lot of time or energy thinking about how effectively am I leading, in particular delegating work to the team around me in order that I am able to deliver my more strategic leadership responsibilities as the leader manager of the clinical team. It was really all about me, the clients, and the service. And so when I look back now, and what's helped me to develop this passion now is there is actually a lot we can do in our leadership journeys to learn about delegating effectively. And it doesn't have to be, a big, an MBA or anything like that. We can actually, get involved in some bite-sized pieces of learning, do some work with other professionals to really help ourselves develop these skills. And it makes a big difference to how effectively we do lead.
Yeah, great. I mean, a couple of things that you mentioned there I want to draw upon. One is you mentioned that you kind of had the clinical expertise. And I imagine, and certainly with some people that I work with, a lot of people in leadership roles have escalated into those leadership roles because their clinical skills have been phenomenal. So, what you also shared there is, didn't mention it, but I'd love to hear your thoughts about it. How much leadership training did you get?
Yeah, look, I did get leadership training. I worked for an amazing organisation who invested in leadership development opportunities for their sort of new frontline leaders, if you like, a little bit down the track. So it certainly wasn't in my first year of leading. And I certainly, when I engaged in that leadership development opportunity, relished the opportunity to do that and do it collaboratively with other leaders in my organisation, and actually have conversations with my peers around, hey, we actually are all leaders. And there are actually things called leadership skills, leadership competencies. We can actually support each other to develop those and talk about how well we're doing it, how our leadership is being experienced by not only the very important patients and clients, but also the people in our teams that we're leading. And really, until those formal opportunities, as I say, everything around me was really directing me to manage the service, and not a lot of environmental sort of supports or reminders, your key role is also to develop the people that you're leading. And I think that this is common in healthcare, understandably so. We're all there to deliver quality services, highly safe and effective services to people with health needs.
Sure.
However, we can look at ways to do that most effectively. And it's my belief that we need to reserve time and energy also for thinking about how well we're leading the people that in our healthcare teams are doing that. We're not doing it alone in healthcare. We are absolutely doing it in teams and paying attention to the quality of our teamwork, and how, particularly as leaders, we're helping our people grow and develop in their roles. Is really, really important. And sometimes I think we get the balance a little bit skewed.
Yeah, I heard you say, we have to make the time to do leadership, basically.
Yep.
We have to make the time to consider, how do we develop, how do we upskill, how do we support, how do we work collaboratively? Because the skills and the talents there, it's, as you said, if we're really just focused on client care, which is obviously essential, how can we actually do both? How can we make sure that we see it as a both and? So let's talk a little bit about that. My experience of working with health leaders is that a lot of people know how to delegate. So they know actually how to ask someone to do something. I mean, they do it in their personal lives and they've done it within their work lives as well. But there's often that kind of core belief system that blocks us from asking for help or handing over a task. So from your experience and, personally, as well as the people that you've worked with, what are some of those kind of core beliefs that hold us back from delegating?
Yeah, absolutely. So I think it is important to acknowledge there are real external barriers at times in the healthcare context to exercising those effective delegation skills, So for example, there's strict regulation, as there should be, and there is specific scope of practice to specific roles. So that's really important. However, I completely agree that there are a number of internal factors that can get in the way of healthcare leaders that actually want to delegate more, and they know I should be delegating more. And what I'm finding is when I'm exploring with them, so what are those, personal barriers getting in your way? I'm hearing beliefs like, my team are already overloaded. The last thing I want to do is give them more work to do. I don't want to add to their burden and add to their stress. I'm already worried about them burning out and leaving and me not being able to replace them. So why would I give them more work to do? That's the total opposite to what I think, what I actually believe I should be doing. So even though I agree, in theory that we should be growing capability, in practice, given the caseloads, the staff shortages that might be in place, the urgency of needs for patients and clients, I do not feel that is the right thing to be doing. I think that's probably one of the most, limiting beliefs that I see.
Yeah, 100%. I mean, with any leader I work with in the care or the aged care industry, same thing. It's if I ask them, what is it that stops you from delegating? It, by far, it's that core belief that everyone's so snowed under. I don't want to put more pressure on them. We've already got so much to do, and what you said before is just spot on in terms of what if they leave, and then where are we left with then? It just puts more pressure. So this kind of biting our tongue, and let's not forget, a lot of us are attracted to the health industry because we are very caring and want to look after other people. But when we choose not to delegate, it impacts on us because we end up carrying that kind of heavier load sometimes. But we also, I suppose some of the costs of not delegating are, things like people can't grow and develop. It's not always a negative thing around stress or workload. It can often be around, well, and often I've come across people saying, well, my manager doesn't delegate to me, and why won't they, let me help them? Or I've been doing the same job for so long. Yes, I've got so much to do, but I'd love a bit of variety. And so when leaders often go, oh, okay, so if I'm delegating this more complex, challenging task, to someone who's already busy, it might not necessarily be the thing that tips them over. It might actually be something that goes, oh, thank God, I needed some kind of, mental break from the routine stuff that I do all the time. Have you come across something like that?
Yeah, absolutely. And I think the thing about beliefs is that they, when we believe them, so we believe them to be true.
Yeah.
And what I really value being able to do with healthcare leaders is give them some time and space to actually examine that belief and understand that, while it feels very true to them, it is something that they believe. And unless they've actually directly discussed with their team member, hey, there is this piece of work or this task that needs doing, it isn't actually something that only I as the leader can do. I do believe that you could do it, or could do it with support.
Yeah.
How would you feel about that? Unless we've actually had that discussion, we've deeply listened to what they've said, we actually don't know what their response or feeling might be to that opportunity. I think sometimes, though, our belief that it's going to burden somebody else prevents us from even having that conversation. And my experience has been sometimes when leaders experiment with just gently exploring it with a team member, they're often surprised that the team member does actually see it as, an exciting opportunity, a break from the day in, day out. They're honoured to be asked. They're honoured to be thought of as somebody who's capable to do that. They're honoured to be trusted with something. It's actually sometimes the leader's own story, that a task that they perceive as a burden because it's just another thing on their list, actually for somebody else is a unique opportunity. And I feel sometimes we get in our own way a little bit, and I speak from experience in that statement.
Yeah, absolutely. So I heard, a very practical strategy is to actually have the conversation, and I like the way that you kind of mentioned it. It's kind of, broaching the subject, but also giving them a bit of an out. This is an opportunity. Not sure if that's something that you're interested in. I think you're fully capable. At the same time, if you feel like you've got too much on your plate, that's cool too. Or if you'd like some support, let's do it together, or whatever it might look like. I think something for the viewers to have a bit of a think about for themselves too is, so some of you viewers might connect with that belief system that, I don't want to delegate people who are already really busy, and I don't want to tip them over the edge. But have a think about some of your other views, and I can think of a few that I've come across, and probably some myself, where I've gone, well, it's quicker if I just do it. That can be sometimes a bit of a core belief system that blocks me. The one that I hear a lot from healthcare professionals, particularly because of all the legislation and stuff and attached to it, is, well, at the end of the day, it falls back onto me. I'm the responsible one. So if it goes wrong, it's on me. And so I always encourage people to kind of challenge that a little bit too, based on what you're talking about as well. Our thinking is often our biggest blocker. So if you play that out, and if we want a different result, then sometimes we need to shift that view.
That is so interesting about, at the end of the day, it falls on me. And so I'm the one that needs to ensure that quality service was delivered. I don't want there to be any mistakes or gaps, because the stakes are so high in healthcare, aren't they? People's lives can be at stake. The ability of the service to continue operating can be at stake. So, Abby, can you tell me a little bit more? How do you really unpack that with healthcare leaders, that sense of, well, at the end of the day, it's all on my shoulders? Because I think that's really important. Really
Yeah, and
relevant.
I suppose what we do is we do a little bit of reality testing, and because I'm not there to kind of challenge or to say that that view is wrong, but I get
Yeah.
kind of curious with them and just go, help me understand, what that actually means and what that actually looks like, and where's that actually played out before, or is there a possibility of a different view, and then I often look at what are the costs and the benefits of having that particular view. Right. So some of the the benefits of holding that view that or that belief system that it all falls back onto me. I'm ultimately the responsible person. The benefit of that is it justifies me not delegating. It justifies me, and it keeps me safe to a degree. But if we look at the costs, they're costs to often satisfaction from employees or the team members. It can be a poor perception of the leader because they're not seen as someone who's delegating and sharing the load. It can lead to burnout for the leader. It can lead to innovation. I mean, there are so many costs. And so it's not usually until the individual connects that the costs outweigh the benefit that they're willing to shift and change. And so once they kind of view, oh yeah, actually there's the costs are not very appealing anymore, then they're more likely to shift the view. And so I often work with people say, what's the result that you really want? And it's usually at that point where leaders will say, well, I want my team to feel motivated. I want them to feel like they're growing. I want them to feel like I trust them. I want to let go of some of the, weights that I'm carrying on my own shoulders. Okay, so if you want those results, what do you need to do differently? And that's when they usually say, well, I need to delegate more. Okay, so you know how to delegate, but what view can you try on differently over the next week or two? Like any habit, it takes about 2 or 3 weeks to kind of, create something new synapses in the brain. So, people might come up with their own views, such as, delegation. And if I delegate, it actually helps people more. If I choose to delegate, even though I'm responsible, I choose to share the load, or there's benefits that I see with delegating. Who knows? And I'm conscious that whatever I say, might not be the right view for people. They have to come up with that themselves.
Yeah.
Yeah.
Yeah, that I think is so important because, often I hear people say it's quicker for me to do it myself. That's what leads me to do it myself. And, I totally acknowledge that could absolutely be the case. I mean, why wouldn't you be quicker? You're probably a more experienced clinician, you're managing a number of clinicians all doing it. So you've seen the best, quickest version and you've adopted that one. I mean, there's a myriad of reasons why you would be quicker. Absolutely.
Yeah.
So I guess that might be under the benefit column. That's why
Yes.
it's good for me to keep doing it myself. I'm not here to argue with you that it wouldn't be quicker. If it was only time, management of that particular aspect of where people's time is going in relation to that clinical task, then sure, keep going with what you're going. But as you say, if you want a different result overall, which if you do want yourself to be a sustainable healthcare leader who's not burnt out, you want your team members to actually grow and, succeed come into your role at some point in time, then what would that lead you to do with that task that, you could probably do quicker? Do you choose to do it? Or do you choose to give somebody else the opportunity to do it, even knowing that it might take longer? What's the reason why you might choose to do that? And that's the difference, I think, between training somebody in delegation, which, as you say, people actually do know how to do that, but really coaching people to delegate is really looking at why, what's the belief system and what belief system do they want to adopt to get the results they want. So good. So good what you're saying there.
Do you have other, because you've done some training and now you train others or you coach others on how to do to be effective in their leadership roles. What other practical strategies? So we've talked about shifting views, but have you got other practical strategies that you use for this topic?
Yeah, I have. So, I think with the support that I can provide people around leadership development, there is coaching there, and there is also some mentoring and helping people in healthcare access some of the great frameworks that are out there that they might not have come across yet because they've been brought up, if you like, in their career, in a clinical career, and there's huge amounts in that. The pace of healthcare delivery is changing, the settings are changing, so they've been very, very busy and engaged in, developing, innovating healthcare services.
Yeah.
So sometimes I'm the first one to introduce them to frameworks like RACI, which is helping leaders identify, okay, so we've got all these responsibilities and accountabilities for our team. Which roles are, best placed to do what, in the team? So this work is coming into the team, and a framework like RACI can help them with their team members work out. So I, as the leader, am accountable for all of these outcomes that the team has to deliver. Who actually would like and is well placed to take on the responsibilities? So while I'm accountable, all the responsibilities don't need to sit with me.
Yeah.
And if that's the case, then what sort of communication structure are we going to have, and support structure, so that everybody in the team's really well equipped to deliver those responsibilities? When do I need to be informed or consulted with as the leader, and when do I not?
Yeah.
If we can have those clear sort of planning and structural conversations, so everybody's got really good role clarity, that actually goes a long way. Because
Absolutely.
often in healthcare, we just don't talk about that stuff. It's sort of assumed that,
Yeah.
okay, the role, the title says it all. But actually, in other teams, in other sectors, there is a lot of discussion going on around who's doing what and why strategically they are the best to do that. And I think we could do more in healthcare to talk about what I, as the leader, am needing to do. Like, what is strategic leadership? And if you are helping us as a team take on those responsibilities and exercise your talents in those areas, then I am able to do this strategic leadership, which could benefit us as a team and our clients, and perhaps help us grow the service or innovate or collaborate, partner with other organisations. And I can't do that stuff if I'm doing the things that actually we know you're capable of or could grow the capability to. And I think being more open around talking that through would be healthy.
Yeah, I think for those of you who are not familiar with RACI, you can simply Google it, RACI. So it's a useful kind of framework to use, and it also doesn't take long. So a RACI conversation, and I think that's, if we kind of bring it back to feeling time poor within this industry, it doesn't have to take long to have that discussion. And the distinction between accountability and responsibility is a good one to kind of get clear on with your team, so that despite you being accountable, there are other people that can be responsible for the actual doing part, and just having those defined roles can be really helpful. We've got about 5 more minutes left, and if there's any questions that anyone has that you'd like us to chat about, please pop them into the comments section on the chat function. But while we wait to see if anyone asks any questions, are there any other kind of practical strategies that you can think of that you want to share?
Yeah, look, I think it is important to have a practice of these delegation conversations. Sometimes people can feel really uncomfortable because the story them telling themselves about how the person who they're hoping to delegate to is going to respond is a very loud story. So they actually feel awkward, uncomfortable. And sometimes just practicing those conversations with a supportive peer, or with a coach or with a mentor, and actually working to a bit of a framework. So just getting clear on yourself, so how am I going to explain the need to delegate? And what am I going to define the delegation sort of context as? So what level of decision-making authority am I seeking to hand over here? Am I saying go away and do it and then tell me when you've done it? Or am I saying, yep, carte blanche, off you go? Or am I saying, get it clear, what would be ideal in my view? And then, what level of curiosity do I have about the other person and what level of authority they might see that they can take, in this task? Thinking about a plan to actually help the person achieve the task or responsibility successfully. So that's your job, as the manager, to ensure their success. So spending a little bit of time thinking about what you could do to help them be successful. And then, what would be the checkpoints? How could you, in terms of that plan, support them along the way? Just have all that sort of ready to go, and then actually practice, as I say, having the chat or conversation. This is something that you can grow skills in and get better with time. And it can come easier and easier and easier, and it can feel lighter and lighter and lighter. So if somebody says, oh, no, thanks, I'd rather not, it's not such a big deal anymore, because you're actually looking for opportunities to delegate every day. So the odd, no, I actually am a bit overloaded at the moment, or, I'm happy to do that. What do you think about me dropping this? Yeah, that's fine. You can get more comfortable with that. It becomes more normal and less of a, I need to delegate something, big and scary. So just like any clinical competency that you've developed over time, you can get better at this stuff. And it makes the world of difference to your experience in leadership and management. Yeah.
I had a little smile on my face earlier because I was thinking about, I worked with a client who, a leader who finally she realized she was she didn't delegate because she had this view that she could do it better than anyone. So I loved her honesty, but and maybe she could have, but what was fascinating for her is that she went, all right, I'm doing it, I'm going to delegate. And so she delegates, she comes back and she's like, oh, it didn't go well. And I was like, why? And she said, because I was so anxious all the time. I ended up micromanaging. I ended up kind of, being too. So I think, that self-reflection piece is really critical to kind of go, okay, how do you need to show up in order to, make this person successful in her or his, or their endeavor, so if I'm naturally one who finds it difficult to let go, I'm gonna have to do a little bit of self-regulation in order to help see this through successfully. So I think it's something that kind of made me laugh a little bit. What about one of the questions that's come through is around, what about when delegation doesn't go well? So you have delegated to someone and perhaps they haven't done the quality, outcome that you're after, or you think that could have been done differently or better. What tips or advice have you got there?
Yeah, absolutely. Well, first of all, I would congratulate yourself and the other person for, giving it a go, because it's not easy, particularly in healthcare, for all the reasons that we've already discussed today. And then I think, it's an equal partnership on behalf of the leader and the team member to do that reflection. And ideally, both have done some individual reflection and then together around what are the opportunities to learn from this. Because there is key opportunities for the leader to reflect on what would the leader do differently. So, sometimes we can be, particularly when there's a really adverse outcome, we can be quick to go, okay, the clinician or something, this department, or, just like drop the ball and shift to blame, because people are panicked. They're really, really panicked about what's happened. Yeah. So we want to shift. We want to move away from blame to accountability. So, okay, this has happened, and what are we going to learn? What would we all do differently? Because ultimately, there is going to be something for the leader to learn around how they could delegate even more effectively next time. Perhaps it's around the choice of the task or the responsibility that was delegated. Perhaps it is who it was delegated to. I would say, though, there's something about the guardrails in place and the support that were available to the person they delegated to. Perhaps there just needed to be more checkpoints. Perhaps there needed to be, more safety, psychological safety, for the person to come back and say it's not going well, and it's okay for them to say that. Yes. So I think, to your previous example about that very brave leader who really told you what was really holding her back, and then had an experience of actually, in her view, it didn't go well. It's like, that's because it's learning. We're on a learning curve about how to do this well between you and I, me, this leader, and you, this team member. Let's keep learning. Let's not drop it and say, well, it was a failure, we're never trying that again. Because while that person continues to be employed in your team, while you're, privileged to lead them, you've got to keep going, for reasons discussed. So I would say, don't give up, stay calm and look at what can we learn and put those learnings into action for next time.
Yeah, fantastic. Well, thank you so much. That was always a fun discussion to have around delegation. I think I always have that smile on my face when I'm thinking about delegation, because when we all are really clear about it, what those things that stop us from doing it, we can sometimes listen to our own view and have a little bit of a chuckle at it and go, oh my gosh, it's so absurd sometimes. Why I haven't done this.
Absolutely,
but,
and as a reformed perfectionist, I think this is why I'm so passionate about it, because I know that that really got in the way for me, and if I could do things differently, I would. I can't go back. What I can do now, though, is support others to learn some of those lessons, hopefully earlier than I did, and ultimately I'm on my own learning curve as well, Abby, as we all are, and these things are tricky, and we're here to support each other in those learning journeys.
Awesome. Well, thank you so much for joining me this morning, and this afternoon, I should say, as well, for those over East. And if anyone has any questions, then feel free to reach out to either of us, and we will respond back and hopefully give you a few more tips if we've got them. Hope everyone has a wonderful day, and thanks so much, Luella.
Thank you, Abby. It's been fantastic, and just a pleasure to sit down with you. So thanks again.
All right. Take care, everyone. See you.
Bye.